Hi everyone. I thought I would do a video today to show the differences between the healthcare system in Uruguay compared to the United States. The healthcare system is called a mutualista. It's more of a private healthcare system where you go to certain hospitals and certain networks. It's very similar to an HMO. Um, and I'm going to be talking about my old healthcare, which was covered California, which was part of the ACA, which is the Affordable Care Act. I'm going to show you how according to my projections, in the next 16 years, from age 49 to 64, I will save $261,000. I have spreadsheets, I have data. It's all there. I am making some assumptions in terms of the premium increases, but I have data to back up what I think the premium increases will be in the United States and what I think the increases would be in Uruguay. So I thought I would start off talking about my journey in the US, my experience with healthcare. Most of my career, I worked for employers. So a lot of people already know, your healthcare is tied to your employer. And it's unfortunate because it's not, healthcare should be a human right, and it's not a human right in the United States. It's only an option if you decide to sign up through an employer. Whereas a lot of other countries, like in Europe and in South America, especially in Uruguay, um, it's an option that is given to you because it's funded by the government and other membership fees that people pay into. Um, so what I'm going to show you now is the costs that I was coming from in the United States, what I was paying per month on the Cover California plan, which is part of the ACA, Affordable Care Act, which is quote unquote Obamacare. So for the first year that I became a consultant, started to work for myself. Was the best decision of my career. Um, and I was paying 525 a month, and it was for a plan called a Gold Level. It was with Blue Shield. It was called Blue Shield Trio, and it was gold, meaning like, so I had a 0% deductible, and I paid 20% of any other costs that didn't have a copay. So I think like hospitalization, after a certain number of days, you would have to pay 20%. But luckily, I didn't utilize healthcare that much. Um, but I definitely wasn't rewarded for it because the next year it went up 20%, which was a crazy increase from to 652 a month. And then by the end of 2024, we were leaving anyways to come to Uruguay, but I got another letter that said it was going to 727 a month. So in my projections, and that represented 11.5% increase. In my projections, I'm assuming a 10% increase each and every year through age 64. So for the next 16 years, the increases will go into effect, and I will show you that on the next spreadsheet. So looking at the projections for what I would be paying on that same healthcare plan, as I showed you before, the $727 a month equates to $87.24 a year. And then if you look down, after 5 years, just 5 years from age 49 to 53, I will have paid, or I would have paid, $53,000 on premiums alone, which is absolute insanity. So then going through the 10 years from age 49 to 58, see how those premiums are going up 10% each year. It's 10%. You're paying a 10% increase, and then you're adding that total and paying 10% on top of that every single year. It's compounding. So you end up at age 58 I would be paying a monthly premium of $1,700, which you can believe it because I have proof that this is happening worse to somebody who's age 63 right now. That NPR just released a story, so I'm going to show that next, just to give you a sense of how high the cost is. And she is on the ACA. So, the story I want to talk about, NPR released an article on August 22nd. I will link to the article in the description, talking about certain enrollees that are on healthcare.gov, the ACA, bracing for huge increases because the federal tax credit that made coverage affordable to so many is expiring at the end of this year. And it went back to the pandemic era. And a nonpartisan healthcare research organization called KFF did an analysis to show that premiums will go up 75% for those receiving the tax credit. Now, the people getting the tax credit, they qualify for the tax credit because they make 100% to 400% of the poverty wage. So this doesn't affect everybody on the ACA. Like someone like me wasn't making 100 to 400% of poverty. I made too much to even get a subsidy. That was the other thing. People get subsidies on the ACA. You're only eligible to get a subsidy. I went in and did all the calculations in the Cover California. I would have had to make under $47,000 a year to receive any sort of subsidy. So I was paying the full amount. So this woman, Ellen Allen, who's 63, was paying $479 a month in West Virginia. Her premium is going to go up to $2,800 a month because she's no longer receiving that tax credit. So again, the US healthcare system is completely broken, and no one, Republican, Democrat, no one can fix it, and no one's willing to fix it. So now I'm going to show you the rest of my predictions for the United States. Then I'm going to dive into what I'm paying in Uruguay, and then I'm going to show you the cost savings. So if you look at the remaining years from age as a reference, age 58, my premium is $1,700, projected to be $1,714 a month. Then it goes to 1885. Then you're in the 2000s by age 60. And then finally, age 64, $3,036 a month. And I believe it. I believe that this would be the total had I stayed. So for 16 years of costs from age 49 through 64, the total premiums paid would be $313,625. Now let's get to the fun stuff, which is the costs in Uruguay for my healthcare premiums. I'm currently in year one. As you can see, there is a breakdown, and I'll explain. So the base cost, I believe, was around like $85 a month when I signed up. And how I signed up was I went into the Española office. I had my cedula, which is the ID that everybody gets as a temporary and permanent resident. Everybody in the country has it. We got those in January. So when I went in late January, I walked in. I used Google Translate. I tried to do my best, and I'm not fluent in the language by any means. I'm trying right now in Spanish, but there was luckily somebody there that could speak a little English, and I was able to get through the transaction and sign up. So the $85 is the base cost for the premium with Española, and I also signed up for Viaje, and they partner with a different company for the it's like a travel assistance policy, because I knew I'd be traveling outside of Uruguay for at least a couple months a year, because I come back to Massachusetts to help my mom out, typically in the US, North American summer. That's actually where I am right now. I'll be going back to Uruguay in early September. Um, so that costs, I think, like $6 to $7 extra a month. So that's why it's 97. And then there's the other cost called Mobile, and covers any type of ambulatory services. Also, it covers house calls, which is crazy that you can have that. Someone, you call you call a number, or you WhatsApp, and they will come to your home. If you don't want to go to the emergency room, they have on-call doctors that can come and help you if it's like not a super critical emergency, which I think is amazing. It's an amazing service to have. So I went ahead and signed up for it. I did not have it initially, and it took me a couple months to figure out that I didn't have it. And then I just went into one of the uh, Española offices and I signed up, because they already had all my information. So it was pretty easy to do that. So you can see that I assumed a 10% increase every single year, and I'm not sure if that's going to be the case. But to be fair, I was more aggressive. Also, there's a possible surcharge in year 10, or right before I turned 60. I don't know if this is going to happen, but I have heard stories about people coming into the country, if they're over 60, having to pay a surcharge to get into a mutualista. And then there are premiums like $200 a month. But I'm not sure if you're already in the system. I think you just pay the increased premium for whatever your age is, and it might jump up at 60. So I'm just factoring in an additional $5,000. And I will adjust this as time allows. But this gives you a good sense of how much money I'm going to pay from 49 to 64. So what now, we're going to look at the costs for the first 5 years compared directly against my US costs. So you can see in year one, the year that I'm in, my total premiums are going to be 1321 under Española, and they would have been 8724 for an annual savings of $7,400. And then you can see that each year it goes up and up and up. So you're looking at $7,400, then $8,100, then $8,900, then $9,800, then $10,800, for a total savings of $45,000 in the first 5 years saved on healthcare premiums. So if you look at the next, from age 54 through 58, so the next 5 years, I will save an additional $72,000. And you can see on the spreadsheet how the math is working out. Basically, each year I'm now into the tens of thousands of dollars of savings per year, starting out with at age 54 with an $11,000 savings through age 58 with a $17,000 savings. And so the total through the first 10 years of savings through age 50, from age 49 to 58, is $72,000. So the remaining 6 years, age 59 through 64, is definitely interesting. There's that surcharge that I told you about, that it may or may not be there, but I'm adding in that as a possibility. And you can see that the savings just become like really, really high per year. Like at age 60, I'm going to save $21,000 a year in premium based on the projections that I have. I could be wrong, but I think it's at least going to be in the ballpark. So from age 59 through 64, the total savings is 143,000. So then for the entire 16 years, this is where I get the $261,128.66 is what I project to save.